So today we will discuss about the most important bone and one of the toughest bone in the lower limb. Okay. So this is hip bone. Okay. So where it is located? This is located mainly our hip region. Okay. And this is irregular large shape bone. Okay. So first we discuss the different parts. Okay. So you can see here one large part is there. This is called ilium part. Okay. This ilium part is always located superiorly. Okay. And another is pubis part. This pubis part is always directed anterior medially. And another is ischium part. This ischium part is directed posterior inferiorly. So see, this is the location of the hip bone. Okay. You can see this is the lumbar vertebra, this is the sacrum, this is the hip bone, this is the ilium part, this is the ischium part, and this is the pubis part. Okay. See, this is the ilium, this is the ischium part, and this is the pubis part. Okay. So first we discuss about the anatomical position. Okay. So you have to know that here one cup-like structure is present. Okay. Cup-like shallow one structure is present. This is called acetabulum. Okay. Since this acetabulum is always directed laterally, means lateral side. Okay. And this is the ilium part. This ilium part is always directed superiorly. Okay. And this is the pubis part. This pubis part is always directed anterior medially. And this is the ischium part. This is the directed posterior inferiorly. Okay. This is always directed laterally. And this is the ischium part is always directed superiorly. And this is the pubic part is always directed medially. Okay. And means anterior medially, like this. Okay. So you can hold it like this. Okay. Your 4 fingers should covered by the acetabulum part. Okay. So see, this is the right sided hip bone. Similarly, you can see this is the left sided. See, the acetabulum is covered by my 4 fingers. Okay. And this acetabulum is directed laterally. This is the ilium part, this is the pubic part, and this is the ischium part. Okay. See, if you want, you can write it down. Okay. So this is large irregular flat bone in the region of the hip. It's having 3 parts: ilium, ischium, and pubis. See, the upper hip bone is present upper expanded part and lower expanded part. Here one cup-like structure is present. This is called acetabulum. Below the acetabulum, another structure is present. This is called obturator foramen. Okay. And this anterior medial part is called pubis, and the posterior inferior part is called ischium. Okay. Ilium is, this is the ilium. Ilium is superior. This is the pubis part. Okay. This is always directed anterior and medially. Okay. And this is posterior inferiorly. Okay. So this is the anatomical position. So now anatomical position. Okay. You can see here another structure is present. This is called anterior superior iliac spine. Okay. This is called anterior superior iliac spine. And another structure is present. It is called pubic tubercle. So this anterior superior iliac spine and pubic tubercle are present in same coronal plane. Okay. And anatomical position, this acetabulum is always directed laterally, and this is the ilium part always directed superiorly, and pubic part is anterior medially, and this is called ischium part is always posterior inferiorly. Okay. See, if I hold this bone like this is right or wrong? See, because acetabulum is not covered by my 4 finger. Okay. First we discuss the parts. Okay, then I have to give the. So first we discuss about the ilium part. Okay, this is ilium. So this ilium having 2 ends. Okay, one is upper end, another is lower end. Okay, So this is called upper end. This upper end is also divided two parts. Okay, one is ventral segment. Okay, another is dorsal segment. Okay, so this is the upper end. It's also divided the two parts. One is ventral segment, another is dorsal segment. This ventral segment is also divided by three parts. Okay, one is this side is outer side. Okay, see here. The bone is located like this. Okay, so this part is outer and this part is inner. Okay, so see, this is the upper end, this is the ventral segment, and this is the dorsal segment. So this ventral segment also divided by three parts. One is outer lip, another is inner lip, another is intermediate lip. Okay, similarly the dorsal part is also divided by the two parts. Okay, another is outer lip and inner lip. Okay, and there are three borders are present. Okay, one is anterior border. This is called anterior superior iliac spine, because this is located anteriorly and this bone is located superior. So anterior superior, and this bone is named ilium. So iliac and crest. Okay, crest like structure. So anterior superior iliac spine, and this part is called anterior inferior iliac spine. So the anterior border is located anterior superior iliac spine to anterior inferior iliac spine. Similarly, this is the posterior border. So this is located posterior superior iliac spine to posterior inferior iliac spine. In another border is there. This is called medial border. Okay, so three border, and it's having three surfaces. And another is outer surface, or it is also called gluteal surface. So this is called outer surface or gluteal surface. Okay, and this is called inner surface or iliac surface. Okay, it is also called iliac fossa. Okay, so this is the outer surface, this is the inner surface. The outer surface is also called gluteal surface, and the inner surface is also called iliac fossa or iliac surface. Okay, another surface is present here. It is called sacropelvic surface. Okay, first see, it projects upward from the acetabulum. This is the acetabulum, upper part. Okay, and present superiorly. It's having two ends. One is upper end, another is lower end. The lower end is located upper part of the acetabulum. Okay, three borders. One is anterior border, posterior border, and another is medial border. And three surfaces. One is iliac fossa, means this surface is called iliac fossa. Okay, and this surface is called outer surface or gluteal surface. Another is sacropelvic surface. Okay, you can write it down first. This part is acetabulum, this hollow structure. See, this is the upper end. This is also called iliac crest. Okay, see here, the anterior and posterior end of the iliac crest. This is called anterior superior iliac spine, and posteriorly it is called posterior inferior iliac spine. So okay, so this is the anterior end. Okay, this is the upper end, this is the anterior end, this is the posterior end. Okay, in the anterior end, anterior superior iliac spine is present. Similarly, in the posterior end, posterior superior iliac spine is present. Okay, see, in the anterior superior iliac spine. Okay, see, it is the anterior superior iliac spine. Here, sartorius muscle and inguinal ligament is attached here. Okay, similarly, in anterior inferior iliac spine, here reflected head of rectus abdominis muscle attached here. Okay, and this is the posterior superior iliac spine. Here, the sacrotuberous ligament is attached here. Okay. Okay, you can write it down. The anterior end, this is the anterior end, and this is the posterior end. This anterior end is termed as anterior superior iliac spine. Similarly, the posterior end is posterior superior iliac spine. The anterior superior iliac spine provides attachment of the inguinal ligament and sartorius muscle, and the posterior superior iliac spine provides attachment to sacrotuberous ligament, the upper end. Okay, this iliac crest is divided into a larger ventral segment and smaller dorsal segment. Okay, see the ventral segment. This is the ventral segment. This ventral segment is also divided outer lip, inner lip, and one is intermediate lip. Okay, see in the outer lip, this is the outer lip. Here three muscles are attached. One is tensor fasciolata, another is external oblique, another is latissimus dorsi. Three muscles are attached here. Okay, see this is the intermediate area. Okay, here internal oblique muscles is attached. Okay, and this is the inner lip. This inner lip is also divided the two parts, anterior 2/3, posterior 1/3. In the anterior 2/3, transverse abdominis muscles is attached. Okay, and the posterior 1/3, quadratus lumborum muscles is attached. This is mainly the abdominal muscles. Okay, see this is the ventral segment. Okay, and this is the dorsal segment. This is the anterior superior iliac spine, anterior inferior iliac spine, and this is the posterior superior iliac spine and posterior inferior iliac spine. See here, this is the tensor fasciolata muscle, this is the external oblique, and this is the latissimus dorsi muscle. Okay, and this is the mainly iliac fossa, means posterior, means inner surface. Okay, you can see here this muscles is attached here na, quadratus lumborum muscles, and this is the transverse abdominis muscles attached here, anterior 2/3, posterior 1/3. Okay, then the borders. Okay, it extends from the anterior superior iliac spine to anterior inferior iliac spine, and in the anterior inferior iliac spine, rectus femoris muscles is attached here. Okay, straight head of rectus femoris muscle, and this is the posterior border from the posterior superior iliac spine to posterior inferior iliac spine. This is the anterior border. This is the anterior superior iliac spine to anterior inferior iliac spine. Similarly, this is the posterior border, posterior superior iliac spine to posterior inferior iliac spine. Okay, and this is the medial border. Okay, so this medial border, this is separate these two surface. Okay, this is the iliac fossa. Okay, and this is the sacropelvic surface. So this border is divided the two surfaces. Okay, oh sorry, this printing mistake, posterior inferior hoga. See, this is the medial border. It separates the iliac fossa from the sacropelvic surface. Okay, and see, lower 1/3 of the medial border forms a rounded arcuate line. So this is the lower 1/3. Okay, of the medial border. This is the medial border. This is the lower 1/3. Okay, this portion is forms one line. It is called arcuate line. Okay, this is the arcuate line. This line. Now the surfaces. Okay, so this is the iliac fossa. Okay, so it is a shallow surface on the inner aspect of the ilium. Okay, below the, this is the iliac crest, below the iliac crest, in front of the medial border. And iliacus, this is called iliac fossa. So here iliacus muscles is attached. Okay, here. See, next is gluteal surface. Okay, this surface is called gluteal surface. Okay, you can see here, this is called greater sciatic notch. Okay, by the presence of three gluteal line, it is called posterior gluteal line, this is called anterior gluteal line, and this is called inferior gluteal line. By the presence of three gluteal line, the gluteal surface is divided into four muscles. One is gluteus maximus, another is gluteus medius, another is gluteus minimus, and another is rectus femoris. Okay, so you can see here, this all the line, it radiates from this greater sciatic notch. Okay, so the posterior gluteal line is present in between the, this is called dorsal segment of the iliac crest. So dorsal segment of the iliac crest to the greater sciatic notch, this line is called posterior gluteal line. So this is the posterior gluteal line. Here you can see, this is the anterior gluteal line. Okay, this is from the tubercle of iliac crest to the this greater sciatic notch. Okay, and another is inferior interior iliac spine to the greater sciatic notch. This is called inferior gluteal line. So by the presence of posterior, anterior and the inferior gluteal line, the gluteal surface is divided into four muscles. One is gluteus maximus, another is gluteus medius, another is gluteus minimus, another is rectus abdominis muscles. Okay, so this is called posterior gluteal line. This line, this is called anterior gluteal line, and this is called inferior gluteal line. See, this is the gluteal surface. Okay, this is the gluteal surface, outer aspect of the ilium, and is divided into three gluteal line: posterior, anterior, another is inferior. By the presence of three gluteal line, the gluteal surface is divided by four muscles. One is gluteus maximus, gluteus medius, gluteus minimus, another is rectus abdominis. Okay. All these lines radiates from the upper margin of the greater sciatic notch. This is the greater sciatic notch. Okay. And the posterior gluteal line, it meets to the this dorsal segment of the upper end or iliac crest, and the anterior gluteal line is meets the close to the tubercle of the iliac crest, and the inferior gluteal line, it's from anterior inferior iliac spine. This, see here, gluteus maximus muscles is attached. This is called posterior gluteal line. So behind the posterior gluteal line, gluteus maximus muscles is attached, and in between the posterior and anterior gluteal line, here gluteus medius muscles is attached, and in between the anterior and inferior gluteal line, gluteus minimus muscles is attached, and between the, this is called inferior gluteal line and upper margin of the acetabulum, here rectus reflected head of rectus femoris muscles is attached. Okay, so four muscles are attached by the presence of three gluteal line. Oh, see here rectus abdominal muscles is attached. Okay, not rectus femoris. Here rectus abdominis. So this is the sacropelvic surface, okay. It's situated behind the medial border on the inner side of the ilium, and it's divided by two parts. One is sacral part, another is pelvic part, okay. So this sacral part is further divided into two parts. One is called iliac tuberosity, another is called auricular surface or articular surface. Why it is called auricular or articular? Because you can see this diagram. This, because this articulates with the sacrum vertebra to form sacroiliac joint. So this is the this surface is called sacroiliac, okay. So here this can articulate with this bone and from sacroiliac joint, okay. So that's all about this ilium part, okay. So what things we have learned here? First, the anatomical position, okay. So how to hold this bone? First is the so like this, okay. So this is the anatomical position. Here two ends are present. One is upper end, also called iliac crest, another is lower end, and three borders: anteriorly anterior border, posteriorly posterior border, and medially medial border, okay. Three surfaces: one is gluteal surface or outer surface, another is iliac fossa, okay, another is sacropelvic surface, okay. In the gluteal surface, four muscles are attached by the presence of three gluteal lines, okay. One is posterior gluteal line, another is anterior gluteal line, another is inferior gluteal line. So behind the posterior gluteal line, gluteus maximus muscles is attached, and in between the posterior and anterior gluteal line, gluteus medius muscles is attached, and in between the posterior and inferior, gluteus minimus muscles is attached, and below the rectus abdominis muscles is attached, and here in the iliac fossa, iliacus muscles is attached, okay. Now you have to discuss about this part, okay. This is called ischium part, okay. So this ischial part having two primary parts. Okay, one is called body. Okay, another is ramus. What is ramus? One is ramus means the projection of the means bony prominence or bony projection means branch of this bone. Okay, so this is called ramus. So one is body part, another is ramus part. Okay, first we see the body part. Okay, it's having two end. One is upper end, another is lower end. Okay, and three borders. One is anterior border, another is this is called posterior border, and another is lateral border. This is the lateral border. Okay, and it's having three surfaces. One is called femoral surface, another is called pelvic surface, and another is called dorsal surface. Okay, okay. See, this is the femoral surface. Okay, this is located in the between the anterior border and lateral border. Okay, this is the femoral surface. Another is pelvic surface because it is the pelvic part. Okay, so this is the pelvic surface. Another is dorsal surface. Dorsal means posterior, so this is the dorsal surface. Okay, this is the dorsal surface. See, first is upper end. Okay, so this upper end is present posterior inferior to the acetabulum. Okay, so this part is called upper end. Okay, posterior inferior to the acetabulum part, this is called upper end. And in the lower end it forms one tuberosity. Okay, this is called ischial tuberosity. Okay, so in the ischial tuberosity important four muscles is attached here. Okay, so you can see here the ischial tuberosity is rough surface and it's having upper quadrilateral area and lower triangular area. Okay, see, this is the ischial tuberosity. So this is mainly present in the lower end. So this upper end is located posterior inferior part of the acetabulum. Okay, and this is the lower end. Okay, here ischial tuberosity is present. Okay, first you have to write it down. See, in the ischial tuberosity, there are 4 muscles are attached here. Okay, you can see here. This is the ischial tuberosity part. Okay, so here you can see one is semi-membranous muscles is attached here. Okay, another is semi-tendinous along with the biceps femoris muscle. Okay, and another is this part, adductor longus muscle. So one is semi-membranous, another is semi-tendinous, another is biceps femoris and adductor magnus. 4 muscles are attached in the ischial tuberosity part. Okay. This is the lower. Oh. Now the borders. Okay, so this is the anterior border, another is posterior border, another is lateral border. Okay, this part is called obturator foramen. Okay, so the anterior border, this is the anterior border, gives the attachment to the obturator membrane, because here obturator foramen are present. Okay, see, in the posterior border, okay, one spine-like structure is present. This is called ischial spine. This ischial spine divided the posterior border into 2 notches. You can see, one is greater sciatic notch, another is lesser sciatic notch. Okay, and this is the lateral border. This is the lateral. This border is located laterally to the ischial tuberosity. Okay, so see here. This is the anterior border. Okay, and this is the posterior border. Here one spine is present, it is called ischial spine. Okay, and this is the lateral border. See, its presents a projection called the ischial spine. Okay, so the ischial spine divided the posterior part by 2 notches. One is greater sciatic notch, another is lesser sciatic notch. See, these things are very much important. Okay, the contents of greater sciatic notch and content of lesser sciatic notch means what structure passes through it. Okay, So you can see the first 6 structure is very important. One is superior gluteal vessels and superior gluteal nerve, piriformis muscle, and inferior gluteal vessel and inferior gluteal line, and the sciatic nerve. Okay. Similarly, in the lesser sciatic notch, the tendon of obturator internus muscle and the nerve to obturator internus muscle. Okay, and the pudendal nerve. So these are the contents of greater sciatic notch. Okay, this all thing. Gluteal means here gluteal muscle is present. Superior, inferior, easy. Superior gluteal vessels, superior gluteal nerve. Inferior gluteal vessel, inferior gluteal nerve. Then one muscles, piriformis and sciatic nerve. And this lesser sciatic notch, one muscle is attached here, obturator internus. This muscle tendon and nerve. And one nerve is passes through it. This is pudendal nerve and pudendal internal pudendal vessels. This muscle, one muscle. So this is present lateral margin of the ischial tuberosity. Okay, and it's having attachment to the tendon of obturatus external muscles. Okay, this part here obturatus external muscles tendon is attached. Okay. Next is surfaces. Okay, so this is called femoral surface. It is present in between the anterior border and lateral border. Okay, another is pelvic surface. Okay, and another is dorsal surface. Okay, so 3 surfaces are present here. Okay, femoral, dorsal and pelvic surface. First you see the femoral surface. Here 2 muscles are attached. One is obturatus externus muscle, another is quadratus femoris muscle. Okay, so 2 muscles are attached here. One is obturator externus, another is femoris. So in the dorsal surface, obturator internus muscle tendon is attached here. Okay, this part. So see, this is the pelvic surface. Here obturator internus muscles is attached. This surface is smooth. Okay, so it is smooth surface. It gives origin to the obturatus internus muscle here. Next is ramus part. Okay, so this part having, see, one outer surface, another is inner surface, another is upper border and lower border. Okay, and this is the pubic bone. So here another ramus is present. It is called inferior ramus of the pubic bone. So these 2 ramus are conjoined together and form conjoined ischiopubic ramus. Okay, you can see it's having two surface, outer surface, inner surface, two border, upper border, lower border, and pubis joins with the ramus part of this ischium and form conjoined ischiopubic ramus, this part. Next we have to discuss the pubic part, okay? So first, anyone hold it anatomical position, okay? Back. So. Stand up. This is right sided or left sided? See first. Okay, the points, anatomical position. The acetabulum should be lateral side and the acetabulum should covered by our four fingers, okay? The pubic part is always directed anterior medially and the ilium part is always superior. So this is the left sided bone, okay? Okay, sit.
Sir, acetabulum should be covered with this four finger. This is right side. And this ilium should be superiorly.
Yes.
And ischium should be.
This is the pubic part, okay? This part is pubic. Pubis in lower, yes, okay. This should be located anterior medially, okay? And the ischium part is posterior inferiorly, okay? Okay. So this is the anterior superior iliac spine and behind it posterior inferior iliac spine, okay? Okay. This part, okay? So this is mainly anterior medially, not anterior inferiorly, okay, of the hip bone, and it's having three parts, okay? This is called superior ramus. This is the body and this is the inferior ramus. So it's having three parts. One is superior ramus, another is body, and another is inferior ramus. So you can see the body, it's having one crest, okay? This is called pubic crest and another tubercle is present, which is called pubic tubercle, okay? And there are three surfaces are present. One is this called anterior, okay, because this present like this, okay? So this is the anterior surface, another is posterior surface and another is medial surface. So three surfaces: anterior surface, posterior surface and medial surface, okay? So this is the anterior surface, okay? In the anterior surface, four muscles is attached, okay? Adductor longus, gracialis, adductor brevis and obturator externus muscle here, okay? See, this is the anterior surface, okay? This is obturator externus muscle because it is called obturator foramen. So here obturator's external muscles is attached, okay? This is called adductor brevis and this is the gracialis, okay? And this is the adductor longus. So these four muscles is attached in the anterior surface, okay? See, this is the posterior surface, okay? It is also called pelvic surface, okay? Yes, this is the left sided. Means outer side, okay? Yes. So see, this is the posterior surface. It is also called pelvic surface. It is related to our urinary bladder, okay? This surface. So this is the medial surface, okay? This medial surface articulates with the another opposite bone, means this pubic bone, okay? And from like this, okay? And from pubic symphysis. So this is called pubic symphysis, okay? So this is the medial surface. This articulated with another medial surface and from the pubic symphysis. Okay, means here cartilage are present. Okay, that's why this part is joined. One cartilage is joined these two bone. Okay. Secondary means normal things. Okay. Secondary means secondary. Primary, secondary. Your general anatomy class is started here. Joints पर आया तो ना उसमें होगा. Next the superior ramus part. Okay, so it's having 3 borders and 3 surfaces. Okay, one is called posterior border. This is the anatomical position. So this is the superior ramus part. Okay, so here 3 borders are present. You can see here this is the posterior border because this border is posteriorly present. Okay, so this is the posterior border and this is the anterior border. So this posterior border is also called pectineal line and this anterior border is also called the obturator crest. Okay, this is the obturator crest and another is inferior border. It is present in the obturator's foramens. Okay, so this is the posterior border, this is the anterior border and this is the inferior border. Okay, now 3 surfaces are present. One is called pectineal surface. This surface is called pectineal surface or posterior surface. This surface is located between the anterior border and posterior border. So this is the posterior border, sharp border one present here. This is called posterior border and this is the anterior border. In between posterior surface or pectineal surface is present. Now see another is pelvic surface. Okay, it is in between the pectineal line or pelvic border and inferior border. So this surface is called pelvic surface, this surface. Okay, another is obturator surface, this surface. Okay, this is the pectineal surface or posterior surface. Okay, this is present in between the pectineal line and obturator crest. Obturator crest means anterior border and pectineal line means posterior border. So in between this surface is present, here pectineus muscles is attached. Okay, Next is pelvic surface. So this is in between the pectineal line and inferior border. So this is the pelvic surface. This is related to our peritoneum part. Okay. And another is obturator surface. This surface. Okay. So it is present in between the obturator crest, this obturator crest and inferior border. Okay. In between, this is called obturator surface. Okay. This whole obturator foramen is covered by obturator membrane. Okay. But one part here, this is called obturator canal or obturator group. This part is open, another whole the part is covered by obturator membrane. So here obturator, nerve and vessel passes through this canal. Okay. So it's having the attachment of the obturator membrane except the obturator group. Okay. Ultimately it is from obturator canal, and here obturator, nerve and vessel passes through this canal. Okay. So this is the last slide. You can see this is the acetabulum, large cup-shaped swallow. It is directed laterally and it receives the head of the femur and from hip joint. Okay. So that's all about today's class. Okay.